Sawadee and good afternoon once again. Today is Monday, April the 20th, 2020. As the spokesperson had mentioned, around the world now we have around 2.4 million confirmed cases. And of course, a large number have recovered already. But all the same, of course, for all countries around the world, we aim to be at pace with COVID. So therefore, the policies and the responses of the various governments around the world need to be at pace, at par with COVID. They need to commensurate with the scale and the speed of COVID. And whenever there is new data available, that has to be used to the most effective way. We have to recalibrate the new data available to be able to solve the COVID situation. So once again, the Center for COVID Situation Administration, or CCSA, would like to thank the general public for your cooperation in combating COVID. Many people now are getting acquainted, getting used to what you call the new normal in wearing masks and practicing social distancing. And of course, this will not only save your own lives and health, but that of others as well. And of course, since the situation seems to have improved, more cars are seen on the road, reminding you once again, as we did yesterday, that we are not out of the danger zone yet, and it is still of concern that some are lowering their guard, which means that we could be prone to another attack from the virus. So therefore, we must continue to keep our guard up and keep our guard high. On the general situation and the statistics and number of cases recorded for today, we have the slide on screen for you. New confirmed cases we have is 27, which is indeed a good number because it is the lowest number that we have found for this month, making the cumulative number of cases 2,792, and total recoveries and discharged persons we have 1,999, and the number of persons in the hospital, remaining in the hospital for treatment, is 746. While fatalities, once again, we have zero, none, no fatalities recorded for today, making the accumulated total of fatalities 47. Now, once again, if you do the math, just adding up, 1,999, those who have recovered, plus 746, those remaining for treatment in hospitals, plus 47, the number of fatalities, you would have 2,792 as the accumulated total of cases. So we hope that the number of fatalities will remain zero for a long time and forever, and the number of recoveries and discharge to be higher every day. Yes. So as for the observations for the new cases, Bangkok remains to be the location where the existing cases have been found in the highest number, followed by the neighboring provinces and tourist provinces. But proportionally, in terms of percentage, proportionally compared to the population, Phuket has the highest number of percentage proportionally. The number of new confirmed cases show a steady decline now, while the number of recovery is continuously rising, which is good news. And moreover, there have been no deaths, no fatalities for 3 consecutive days. So indeed, this is a positive sign, but we must remain cautious and follow all the preventive measures. The spokesperson also highlighted the number of provinces which still have no cases of COVID infection at all, which is numbers to 9. There remain 9 provinces, even until today, that have had no cases of COVID at all in Thailand. Meanwhile, the number of provinces that have not had any COVID infections for the past 14 days is now 35 provinces. This number of provinces is increasing, so that is also a good sign, with 35 provinces having no new cases in the past 14 days. A few days ago, it was only around 27 provinces. So as the days go by, we tally the numbers, and now we reach 35 provinces. The spokesperson also mentioned about the new measures being explored, such as the research and development, the R&D for new vaccines. To produce a vaccine for COVID, which, if successful, it will be able to prevent the infection of COVID for a massive number of people. He also mentioned in passing about the possibility that a Thai herbal plant called Pha Joan has the properties to prevent COVID. It can play a role in preventing COVID, and of course that is being explored. The scientific name of this Thai herbal plant, Pha Joan, is andrographolide. Yes. For the curfew, we have to remind you once again that it is important to continue to cooperate with the curfew. As you have seen, the Prime Minister had visited checkpoints on site during the curfew a few nights ago, and we hope that there will be no or less violations of the curfew, because those who violate the curfew, sometimes there is the risk of having people who also break other laws, such as public alcohol drinking, driving under the influence, DUI, or racing on roads, gambling and drug offenses, and many other criminal offenses. We also have been continuing to monitor the news around the world, the overall situation around the world, which indicates that the fight against COVID is not over yet. Of course, many countries have seen positive signs, while some countries have remain with many challenges. One example is in countries such as Singapore, where they have seen a large number of increase in positive cases, including from the migrant population as well. So it is not only Thailand. We see that this is a common challenge around the world. All countries around the world face the same problems and the same challenges, be it Thailand or any other country in the region, in Asia, or in other regions around the world. So moving on to the repatriation of Thai nationals. As usual, we join hands in fighting against the COVID in Thailand, and the Thai embassies around the world provide assistance to people around the world. On screen now, we have a chart which summarizes the number of people returning, Thai nationals repatriating back through the government's assistance between the 4th to the 19th of April 2020. Now today is April the 20th, and there are no incoming repatriation flights, so we wanted to recap the inbound flights for the 4th to the 19th of April for you, repatriating a total number of 1,993 Thai nationals from abroad, mostly from Malaysia, the United States, and the Republic of Korea. There is also around 667 Thais through overland border checkpoints, and the others by plane. And of course, all of this repatriation is on a special basis to repatriate Thai nationals, and all the required documentation and entry into the state quarantine process is compulsory, is 100%. And of course, this is according to the general theme that we have in taking care of Thai citizens in Thailand and abroad, under the theme Kon Thai Mai Ting Kan, leaving no one behind. Also, as we inform you every day, the embassies take care of the Thai citizens abroad around the world, such as, I think we have some slides about India as well. Because in times of need, Thai people, of course, show a strong sense of solidarity, and the images you see on screen now is the work being done to assist the Thai nationals in India. That's the Thai embassy and the Thai ambassador meeting and providing assistance to the Thai community all around that country. Also, there is a sense of community because the various Thai associations or communities abroad have helped each other, civil society to civil society, and have extended assistance to local communities in cities. In the example we have today is India, so such as in Chennai in India, where the Thai community has provided face shields for people in need. And this truly is a reflection of expressing the notion that we are stronger together. Yes, some images of the assistance provided in India from the embassy and from the various associations and communities as well. Another issue is about the message of the Prime Minister, wherein every day when we have meetings at the high level or the working level, we hear a very constructive and very uplifting message from the Prime Minister. So recently, today, he mentioned about his confidence that he has in the officials in solving the COVID crisis. And he also expressed his sincere appreciation to the doctors, to the nurses, and to the medical personnel, supporting staff who have risked their lives and worked tirelessly to take care of those infected by COVID. He also mentioned that at this point, the emergency decree is still necessary, and there would naturally, in due course, be a relaxation of certain measures, which will allow the continuation of normal lives, such as in benefit of commercial activities or parks for exercise. But of course, these criteria will be discussed, and there will be clarity for these criteria, these measures for relaxation. Some have dubbed it, of course, as we're discussing an exit strategy so that lives can continue to be back, to return back to normal. And while we are discussing and preparing for this exit strategy, when hopefully COVID leaves us, we will also be studying and monitoring the measures of other countries as well, so as to be a learning process and to find the most appropriate path for Thailand when the COVID situation is ended, and hopefully that is soon. So finally, just some general advice for the general public. Wash your hands often, always wear face masks, repeat this every single day. And that is still necessary, that is very important. And keep physical and social distance. All of us can, of course, help fight COVID by performing your own hygiene practices, maintaining standards, your own personal standards, and in doing so, you can help protect your family, friends, loved ones, and in your community. You can save the country, and you can save the world, actually. So we have some parting infographics for you on social distancing. 2 meters, 1.8 to 2 meters apart from each other. Infographic courtesy of the Public Relations Department. And we also, I believe, have a picture about, I think, a contact number. But we have that today, the hotline number. Yes. Previously, we showed some posters, some slides on the hotline numbers of the Center for Disease Control of the Ministry of Public Health. Today, we have numbers of other related agencies which the English language audience and the foreign community can make use of. Yes, so in conclusion, don't forget to, I'll just summarize as avoid the 3 C's and achieve the 2 C's. Don't forget to avoid the 3 C's. The first C is avoid confined spaces. Second C is avoid crowded areas. And the third is avoid close proximity. Avoid the 3 C's so that we can achieve the 2 C's. The 2 C's. The first is achieve containment and control of COVID together. So, best of luck to everybody. Have a happy Monday. Please stay safe, stay hygienic for your country, for the world, and for your loved ones. Good afternoon. Thank you very much. สวัสดีครับ